So, welcome to Behind the Counter with NJSHP, a podcast for pharmacy students where we interview current pharmacists and talk about topics in the pharmacy world. Hi, I'm Connie. I'm a P1 student and I'm the Public Relations Projects Chair at NJSHP. And I'm hosting this podcast with my co-chair, Shiloh.
Yep. So yeah, I'm Shiloh. I'm also a P1 and I'm co-chair with Connie for public relations at NJSHP. Yeah.
And so in this episode, we're going to be interviewing Dr. Giaquinto and Dr. Wilczynski. They're both clinical assistant professors at MSOP that specialize in cardiology pharmacy, who are also the newest additions to Rutgers NJSHP's team of faculty advisors alongside Dr. Maria Cardinali. So do you guys want to introduce yourselves?
Sure. Hi, I'm Dr. Jessica Wilczynski. Like we said, I am the cardiology clinical pharmacist at Jersey Shore University Medical Center down in Neptune, New Jersey, and I am a clinical assistant professor at Rutgers University. Thanks for having me.
And my name is Andrew Giaquinto. I am a clinical assistant professor at Rutgers. I've been there about 5 years now, and then I'm also a clinical ambulatory care cardiology pharmacist. So I do more outpatient cardiology pharmacy.
Awesome. So thank you guys for joining us today. So jumping into our questions, how did you guys get to where you are right now in your career?
So I can start. So I went from pharmacy school into a PGY1 residency. So that's usually just a general 1 year, kind of a intense appy year for anyone who might not know what a residency is. And from there, I went to a PGY2 in cardiology. So I specialized in cardiology specifically. I know other pharmacists in cardiology positions have specialized in critical care or ambulatory care. There are other options, but I did cardiology specifically. And then I went straight from my training into Rutgers, and I've been here about 5, 6 years.
So I was a similar path, although originally when I went into school, I actually was a biology major. I thought I wanted to do research or something like that. Eventually, I switched to pharmacy. I went to Northeastern up in Boston. I'm from New Jersey though, so I came back home and I did both my PGY1 and my PGY2 at Hunterdon Medical Center down in Flemington. My PGY2 is actually in pharmacotherapy, which is basically like a mix between internal medicine and ambulatory care, I guess is how I usually like to describe it. And then from there, I really like teaching. I've had a passion for teaching since I started, my appies and everything like that. So I applied for Rutgers because my research project that year was actually setting up the cardiology clinic that I'm in now. So we got that set up with Rutgers, and now here I am almost 5 years later.
Nice. So, why did you choose to work in the healthcare system rather than like industry? Because I know for like a lot of people in our year, like industry is getting very popular, or it is very popular. So, why did you two choose to work in the healthcare system?
Yeah, I was gonna say it's not getting popular. It's been
Yeah,
popular
yeah.
forever. I can start with this one. So I actually had experience in both. So one of the really cool things about Northeastern is we had a co-op program. So basically we worked for basically 4 months throughout our schooling to get our experiences for our IPPs. So I actually did a short stint at Novartis up in Boston, and I thought industry was cool. It's definitely a different style of pharmacy compared to hospital or even, retail. Um, but I felt like from a patient impact standpoint, I was making the most impact when I was on my hospital rotations. And I grew up in a family who's very much involved in healthcare, whether it's nurses or PTs. So I was around, hospital or healthcare in general. So really, it's, I guess, where I gravitated because I felt like that's where I was making the biggest difference. And that's kind of just carried forward.
Agree. So I went to Jefferson College of Pharmacy in Philadelphia, and I did my PGY1 and PGY2 actually at Thomas Jefferson University Hospital. So I would say my school, we're a newer, smaller school than Rutgers for sure. And they tended to teach a lot and have a lot of rotations, specifically in the acute care, hospital care setting. So I felt that I was exposed to that probably more than anything. I think we didn't have too much industry exposure, or maybe just the rotations I took didn't really lend me that kind of experience. And I also had an internship at that same hospital starting my P2 year. So I just think early like immersion in the hospital setting paired with I felt on my rotations we were making a lot of impact, as Dr. G kind of mentioned, that kind of just led me down that path, if that kind of makes sense.
Cool. So what do you guys think are like the positives and negatives of working in a healthcare system? Or what do you guys like about it?
So some positives, definitely patient interaction. I work more in the ICU type setting, so Dr. G probably has a different kind of viewpoint. You see a lot more patients than me, but I do actually see quite a few patients one-on-one. So, for example, I work closely with the cardiac surgery service, and I have to do a lot of pre-work with those patients, especially if they're getting some type of mechanical circulatory support, typically like an LVAD or a left ventricular assist device. I need to counsel them on anticoagulation. They need to be on warfarin therapy lifelong. So I love seeing, again, the direct impact we can have on patients and patient care. That's definitely a positive. I also think working with such large teams, I see like attendings, cardiology fellows, residents, all of the nurses, everyone is involved in patient care, especially at bedside rounding, and it's great to see what all goes into caring for each patient. Do you have any positives, Dr. G, before I talk about any negatives I could
Oh,
think
you
of?
want me to start with the positives? Okay. Um, so I think from a positivity standpoint, like I work with some of the best providers I've ever worked with. And I think if you talk to a lot of pharmacists who are in these clinical roles, they just love their providers. Like my providers are my biggest champions as far as our practice are concerned. And I just, they really value us as pharmacists. And I think the model is very much changing to allow us as pharmacists to really work at the top of our license in these clinical areas. So I think in that regard, it's great. Now, on top of that, the patients are both good. I guess it could be a pro and a con, but just the fact that we really are making an impact in these patients' lives is extremely rewarding at the end of the day, where I can go home and feel like I made a difference. I think that's probably one of the best aspects of my job. And then, of course, working, at Rutgers, like we get to have the students and kind of expose all of you to different areas of clinical pharmacy. So maybe you weren't exposed to this type of thing in school and all of a sudden you have a huge interest. Like that is super rewarding and something that I didn't think of going into the job that I would find to be a huge pro. But I really, really enjoy that aspect of things as well. Do you have cons?
I'm thinking of one particular con. So I think in a hospital, pharmacy as a department is kind of a money spending department as opposed to some others. For example, like a surgery department is definitely profit generating. So, though the role of pharmacy is blowing up, it's expanding in so many different services. Even since I've been at my hospital 5 years now, we've expanded pharmacy in at least 10 different ways. But because we are such a profit like loss to the hospital, they don't always want to give us quite as much money, maybe some budget for additional pharmacists. So though our role is expanding, the support comes eventually. It's just a little slower. So it's always like a balancing act with the money part of it.
I would echo that for sure because even in that regard, like we always are having to basically justify our positions, like why we deserve to, be this cost on the department. And, we do that through a lot of things, whether it's collecting metrics or showing, all the things that we are actually helping with. But at the end of the day, we have to constantly be collecting this data to basically prove our worth because hospitals usually run on a very like tight budget. So, having us there is a cost for sure. I think one of the other things, and Dr. W, I don't know if you have the same issues that I do because I'm on the outpatient side more so, but sometimes patients are very adamant about not taking their medications, which I guess is our job, right? Like it's trying to convince them to take them, but sometimes it gets extremely frustrating when, especially now with the internet being so available, I guess, they are constantly, using Dr. Google to diagnose themselves and learn all the stuff that, we went to school for and did residencies for. And it can just be extreme. It's almost like we're doing double the work now because instead of them just, you know, trusting with what we're saying, they're like, well, I read this. And it's like, I have never seen this in my life. Now I have to go back, spend a half hour to see where this even came from. So I think in that regard, it's become a little bit harder for us in the clinical setting because patients have so much information at their fingertips. But that being said, I do think the pros outweigh the cons, but
Now that the internet is so widespread and everyone has access to it, do you think pharmacists are viewed in kind of a better light, or the kind of like their opinions are disregarded more because there's so much information available now?
That's a good question. I think that depends what side you're looking at it from. The providers, I think, are much more reliant on my practice now because of all of this, actually. Trying to educate the patients and trying to get through some of this muck that they find on the internet, on top of the providers just utilizing us for pharmacy things. But I think this has really made their jobs much harder too with taking care of patients. And that's a way that we really have moved into that space to help them. And it's really been, I think it's actually been easier to justify me being in the practice at this point because of that. Like all the providers utilize me for that reason, basically.
That is a great question. I'm going to add and kind of actually expand a little with like the whole AI and how so much more access and like you said, information is available. But I always kind of think of it in that our jobs lay so much in the gray area. Like nothing's black and white in medicine. So you always have to think critically, clinically, and kind of weigh the pros and cons of each treatment. Like Google can't tell you, use this medication in this scenario. You almost have to think it out. So I feel like that's where we are kind of utilized and like safe in a way. There's a lot of gray area situations.
Wow, that's actually pretty interesting, but I mean, I say I'm guilty for being one of those people that Googles whatever they have and like I haven't I remember I wasn't going to the dentist for a while because I thought I was fine, but then yeah, it turns out I was not fine, but have there been like have there been any like strategies or some things to mitigate this problem if or I don't know if how you would like convince a patient who's so adamant about like not taking their medication or not being educated on, their health. Um, I don't know if there are other strategies you guys have talked about to like fix that issue.
Well, so I think, one of the things that when you're in school, you think about it and you're like, man, this is stupid. But the stuff we teach you in like iPass with the motivational interviewing and things like that, where at the time you're like, man, I'm never going to use this. And now you're like, okay, well, let's break this down for you, do all these things, try to convince them. I think one of the things that I have learned to do is, a lot of times we're throwing all this stuff at these patients. And with cardiology, when you get diagnosed with certain disease states, you're started on like 5 or 6 medications just all at once, which can be super overwhelming. So, one, the education is really important, especially when it comes to things like heart failure or post-MI care. That's from the outpatient setting, that's really important. But also working with the patients and trying to figure out what their goals are at the end of the day, right? Like, do they want to try to avoid taking as many medications as they can? It's like, okay, well, these are the really important ones that we need you to take, at least right now. You know, once down any few months from now, maybe we can take some of these off, which obviously, in cardiology, we have specific time frames, but they don't have to know that, right? But trying to work with them so we can get what we need to get done, but also making sure that they're meeting their goals. And I think that's something that we kind of lose sometimes, and the providers are never thinking of. They're just like, why don't they just take this medication?
Agree. I was going to say the same exact thing. Really just open and like two-way conversations with the patient to find out, kind of like Dr. G said, what's the real kind of issue underneath all of this? Is it the pill count? Is it the price? Is there something that we can kind of target and actually work with them? And agree, not that I mean, providers are amazing, but they're pulled in 1 million different directions, so they don't always have like quite as much time to get to the root of those issues, which again, the value of our job. That could be part of it.
why did the two of you choose to specialize in cardiology, and kind of like what was the moment that made you decide this is what I wanted to specialize in?
So I always liked being in the hospital, acute care, and during my PGY1, I had a rotation in the general CCU, so just the cardiac ICU. And I remember we had a lot of patients getting like smaller types of mechanical circulatory support, such as an Impella, which is like a little mini pump, like heart pump, a balloon pump itself. So seeing those and how pharmacists have an impact, like though those are devices, you need certain medications to kind of run at the same time. You need heparin if they're having metal inside their body. So that for me is when it kind of clicked that this was really cool. And this was such a unique subset of patients. And I kind of loved just being in that unit and on that rotation. And I had a great preceptor. Shout out Dr. Susan Varghese at Jefferson. So that really clicked for me. And then Jefferson luckily had a PGY2 in cardiology, so it was almost set up to work out perfectly.
Okay, so I'm a little bit on the opposite. I hated cardiology in school. I thought it was terrible. And I think it's partially the way that we all teach cardiology. It's really hard to teach in the didactic setting. I think, and I've heard from my students as well, like it's easier once you have an example for all these cardiology medications. They're just not intuitive the way that it works a lot of times. So in school, I hated it. I'm like, I'm never touching cardiology again. And then I got to rotations, and I had one in the CCU at Atlantic Health actually. And it was really cool. I got to see an LVAD surgery and like all the stuff that the pharmacist was doing to help and assist in that setting. So I kind of, but then after that, that was really, my experience at that point. And then I drifted more towards ambulatory care. And I really liked, the impact I was making in the outpatient setting. And it just so happened that we have like this really robust cardiology outpatient program at the hospital I was doing my residencies at. So I got to, be the pilot pharmacist for that setting. So I ended up coming back to it, but it wasn't something that was like a straight line for me. I really kind of swerved around. But that was really, it was awesome. I'm really happy that I ended up here again.
Awesome. So what is it like working as a cardiologist? Like, what's your day in the life schedule, being a cardiology pharmacist?
So I'm sure we have two very different types of days. So mine, I usually get to the hospital. It depends if I have students or residents, what type of learners, where they are in the year, many different factors. But usually I will work up patients, see how my learners are working up patients. We'll go to rounds. Again, I work with the cardiac surgery team and the CCU team at my hospital. So it's kind of tough balancing two different rounds as well as my learners. But that's pretty much the whole morning. And then afternoons are usually reserved for projects or teaching, meetings. In addition to working for Rutgers and, in our hospital, we're specifically part of a network. So there's a lot of network alignment initiatives going on for how to align all of our 13 hospitals. So lots of like behind the scenes guidelines, policy creation. Every day is a little bit different, but I think that's what kind of keeps it exciting.
So mine is definitely different. So being mainly outpatient, clinic doesn't actually open until like 8:30. So I get there between 8 and 8:30. I start working patients up for the day. So I follow a few different providers. It's like a staple of my workups, and then I get consulted throughout the day from other providers. So we have, I think, last count, like 21 providers in our practice. So they'll either send me consults through our EHR, or if they have the patients in the office with them, they'll come and get me and I'll see the patient in the office. Or sometimes I'll have patients scheduled with me, but we've worked it more so on a consult basis at this point because, and we don't have to get into this, but billing from a pharmacist perspective isn't great, but providers can bill for quite a bit. And and the way that we actually work it, you can bill at a higher level if pharmacists are involved in the patient's care. So basically, if I see them at the same time as a provider, they can bill at a higher level, which, it's helpful for them. But then because of the way that AmCare works, and you're constantly just some days you're really busy, other days it's a little bit slower. With the Rutgers stuff, sometimes, our afternoons are usually tried to be reserved for rotation activities, whether it's, journal clubs or things like that. But sometimes it works and we have to adjust. So, but yeah, that's normal.
Related to kind of your day in the life, what's the work-life balance? Like how stressed are you every day? I would say, I guess.
What a question.
Well, it depends. Are we talking just our clinical sites or with Rutgers involved in that?
That's Rutgers involved with it too.
So that I think is really one of the hard things. So more, I think, for just straight pharmacists, their work-life balance is great because they basically, once they leave the hospital or their site, they're done for the day. With Rutgers, it's a little bit additional. If you can fit it in during the day while you're, like Dr. W was talking about, uh, doing some afternoon stuff to like catch up on Rutgers things or whatever it may be. If you have the time to do that every afternoon, that's great. A lot of us will try to dedicate some time per week to, doing lectures or whatever we have to do. There's a ton of stuff, but sometimes I bring work home if I'm going to be honest. Like especially in the middle of the semester, like I'm actually one of the coordinators for the endocrine therapeutic module. So right now for the next 4 weeks, I'm just, I don't really have a choice because we're making sure all the lectures are set up, all the exams are set up. So there's just stuff that you just can't always plan. But I think that's more the academia side of things, if I'm going to be honest. But to that point, it's very flexible. Like if I need to take a day off, if I need to leave early, like it's fine. That is not always the case with just clinical pharmacy. So that's kind of the trade-off with the Rutgers side of things. Like we have the ability to, adjust our schedules if it's appropriate for our patient loads. But I mean, I've gotten better at it, I would say. In the beginning, I was working a lot at home, but now it's gotten to the point where once I'm home, I'm home. And yeah, I mean, work-life balance is good for me at this point.
Yes, I think it's definitely different for everyone. I think, like for me, for example, I'm pretty religious about taking my Rutgers day. Like once a week, I'll not go to site. I'll either go to the school or even work from home sometimes, depending on the day. Do I have meetings, etc. And I really try to use that protected time to get my Rutgers things done, and sometimes even Jersey Shore things if I'm really backed up. So I really try to keep it balanced. As Dr. G said, that's not always the case, but the flexibility is definitely helpful. I also think me personally, so I know you work for like a clinic, so your clinic closes. Because my hospital never closes, I actually do get like calls at home at night on the weekend from other pharmacists who the patients are still there and they might have a question. And I also do this to myself. I work per diem at my hospital, so the lines are really blurred. I'm always there or not, or on call unofficially. But it really depends, like what is going on. Is it a patient? Is it an urgent issue? I'm happy to help, but that is something that's being talked about more in my hospital. We might do a formal on-call program just because we are such a big hospital, and there are questions outside of 7 to 3 or 8 to 4, whatever our hours may be. So just to throw in that little tidbit, it might depend on your like practice area, your practice site in a way. But you
I
really,
will say
yeah,
mine's the same because my providers are in the hospital as well. So there's occasions where they'll call me at like 8 o'clock at night, and I'm like,
mhm.
"What are you doing, man? I'm home sitting with my cats, chilling, watching TV. Like, come on, what
Always good.
are you doing?"
Yes. I feel like it really is up to like me to kind of to for us to like set boundaries. And of course,
Mm.
help when there's urgent issues. I don't want a patient to suffer, but I've been trying to reinforce some boundaries lately, so we'll see how it goes.
So hearing about like your busy schedules, I can tell you guys are both pretty passionate about your work, and I can tell your cardiology pharmacist schedule is busy, but adding teaching on top of that, what made you want to teach and like take time out of your week and days to actually teach at MSOP?
Okay. So I actually, again, I did an education rotation when I was in school, which really, I guess, showed me some of the back end of teaching before I was a resident. And then as a resident, we kind of always talk about the like layered learning model. So as a resident, I did a lot of teaching because at Hunterdon, we have 3 Rutgers faculty. So we have a lot of students that come through. And I've had some really good mentors along the way. Dr. Phillips, who she teaches a few of your therapeutics classes. She was my RPD at Hunterdon, so I learned a lot from her along the way as far as teaching and things like that. And I think one of the things that was really valuable for me was kind of, I guess, that light that clicks on at the end of rotations for students, or when they finally start getting the material and like you guys start developing into pharmacists. It's just super rewarding, and it's something that I haven't found in any other aspect of my career so far. It's just really, really awesome to see, or even when you guys find a passion with some type of clinical area, whether it's cardiology or not, because I teach a bunch of other things as well. But I always find when there's something that clicks for you guys, it's just one of the best things in the world. And obviously, we don't gain much from it, but we had a hand in that, which is really nice.
Okay, and now it's my turn to have a totally different experience. So I didn't do a ton of layered learning as a student or even as a resident. I kind of accidentally fell into faculty actually. Like I actually saw this job posted during my PGY2, I think early, like back in February. I didn't think I was qualified, so I didn't apply for 5 months. I was like, I can't do that job. I can't teach. But I finally did apply. I got it. And then my love of academia really kicked in once I was in it. Like, you always have the presentations. I lectured to students once. I maybe saw one rotation student, but nothing to the magnitude of what I think residents at our sites see. So I knew I liked teaching, but I really started loving it in the job. And I like kind of Dr. G said, it's great to see the students just get it. It's one thing teaching it didactically in therapeutics. It's a totally different animal, I think, to actually apply it to real patients and see it in practice. Again, you kind of have to evaluate the gray areas a lot of the times, draw from your own experiences, clinical skills, literature, and it's great to see all of that come together. And I will say Rutgers as a school, as like MSOP as a school, they are great at kind of mentoring new faculty members and giving us opportunities. I don't think I could have maybe done it anywhere else. Rutgers has been great. So for everyone out there who has imposter syndrome, you can do it. I have faith in you.
So out of all the clubs, did you choose to be an advisor for NJSHP, or was it kind of like assigned for you? And if you did choose, why did you choose NJSHP?
I mean, we were definitely given the option. This wasn't like a required thing by any means. So I've been a member and on the board for NJSHP for like the state chapter since I was a resident. And I actually, when I was in school in Massachusetts, I was in their chapter of, it was Massachusetts, hospital pharmacy practice. But so I've been involved in this type of in this organization for a really long time. And I thought it was we got approached for it, but I thought it was a really easy way for me to get involved and kind of like guide, the students a little bit more, because I have experience in the organization at the state level, and I'm passionate about, hospital practice and clinical practice. So it seemed like a no-brainer for me, that's for sure.
Agree. I was involved in PSHP when I was in Pennsylvania. And then once I moved to New Jersey, an opportunity came up to be president-elect of like specifically the central chapter of NJSHP. And then the following year, so last year, I was president. And this opportunity was kind of presented to us right as my presidency was ending. And I thought it was a great way to still stay involved within NJSHP. And it kind of just worked out perfectly.
So, for our listeners listening in, what advice would you give to them or our students who are interested in pursuing a career in hospital pharmacy?
I would say get involved as much as you can. Of course, you're there to learn. Grades and school is very important, but as I was kind of mentioning earlier, it's very different learning it in lectures versus doing things and applying it in real life. So I feel like joining some of these like clubs and different organizations will open the doors to lots of opportunities to like start practicing some of that, whether it's going to like I don't know, a flu clinic or any type of outreach experience. That all is great for not only your CV but also just for great personal experience. So try to balance as much as you can. School's important, but so is outside organizations.
Agreed, and I would echo that a lot. I think getting involved, not just so even when I was in school, I was involved in like music fraternities and things like that. So I think it's important to be involved in a lot of things because even if you want to be involved in hospital pharmacy or even clinical pharmacy, when you're going for interviews, you want to talk about more than just pharmacy. We all have interests outside of this, even though it's great. There's things everybody else likes to do, and that helps you connect. And you're working with these people, so you want to be able to connect with them, right? But I think one of the best pieces of advice that I got and that I try to give to students now to keep an open mind about your interest areas. Because interests change. You may find that there was something that you learned in school, and all of a sudden now you do it in practice, and it's really something you're enjoying. Like by nature, I am very much an introvert, but I love ambulatory care. I think that is like, and this is talking to patients all day, right? Like that doesn't check out compared to me being an introvert, but something that I have a passion for. And I think I would not have had that idea if I didn't try to go out of my comfort zone and really have an open mind about what I wanted to pursue. I thought I just wanted to, be sitting at a desk doing clinical pharmacy, not rounding, but things change. So I think, especially when you guys go on to rotations, like take a wide variety of rotations, even if you think you may not like them. I think, a lot of times it may surprise you when you start getting onto these rotations, be like, wow, this is something that I could really see myself doing. I've had students who are like, I have no exposure to cardiology really other than lectures, and we don't even know what ambulatory care is. And all of a sudden they get the rotation and they're like, this is great. Like, I don't know why we didn't start doing this earlier. So I think just keeping an open mind, going out of your comfort zone a little bit is really the biggest piece of advice I would say if you want to, because there's so many areas of like specialty and hospital pharmacy, clinical pharmacy. The world is really your oyster if you go this route.
My own curiosity, do you feel students decide on what they want to do a little bit too early? Do you think that that's good or bad? Yeah,
Asking the good questions today. I think it can go either way. I think similarly to like going into college, right? Like you're expected to know what you want to do for the rest of your life at like 18. Like I barely knew what I wanted. Like I switched majors, right? Like I didn't know what I wanted to do. I still don't most of the time, I feel like. But I do think it's good to have a path. But I think where it becomes difficult is when you won't stray from that path if you find other interests. Like I think to have a direction is a really great thing. So, I want to be in a hospital. Now, topic areas are all over the place in hospitals, right? But I think some people just gravitate towards it, and I think that's okay. And on the other side of things, like Rutgers really has a great fellowship program. So I think a lot of kids come to Rutgers with the expectation of maybe going that route. So I don't necessarily think that's a bad thing. I just think not having that open mind is, I guess, where that struggle lies.
Agree. Not good or bad, but like Dr. G said, just open mind. And I even kind of mentioned earlier the way my school worked, it kind of directed me toward hospitals. So a lot of times you are kind of influenced by your school, whether you know it or not. And again, not good or bad, that's just life. And something else to keep in mind is you might switch even throughout your career. Good to know that maybe someday in 20 years, if I want to think about industry, that's not completely off the table. I hope. Like there are options available even in life, like not even school, but in life. So keeping that in mind too, nothing is really set in stone. Just something to think about.
Yeah, and to that point, from what Dr. W was saying, I think like 80% of my graduating class in Northeastern did residencies. So it was like very much pushed at Northeastern, even though they have a pretty big fellowship program now as well. So I think it depends where you go. And I know a lot of clinical pharmacists who down the road end up transitioning into industry. So I think that's one of the really good things about pharmacy is you really have the flexibility to go one way or the other and can switch. Like there's nothing that says we can't go into hospital and then not do industry or go into industry, not do hospital. That is always open. Like we have the knowledge, which is what's important.
Okay, so I know Dr. Giaquinto, you said you were so interested in cardiology before you became a cardiology pharmacist. And I know Dr. Wilczynski said your school kind of led you on that path, but after becoming a cardiology pharmacist, have you guys had doubts of your own profession or like wanted to maybe explore other things?
I wouldn't say doubts. I personally also like to keep general hospital kind of in my periphery. So again, that's why I picked up per diem at my current hospital because I like just having dedicated shifts to just doing general hospital just to kind of, keep that knowledge fresh. I would think about maybe in the future if I want to, I don't know, switch jobs, that's an option. I wouldn't say I regret it by any means. I love what I'm doing. I'm still here for the foreseeable future, but again, I like to keep my options open and just know that like again, nothing's set in stone. You could do anything. If you end up hating it, you can change.
So I'm actually in the same boat. I do per diem at my hospital as well because I think staffing pharmacy wise is just very different. It's a different skill set and just super important to, in my opinion, stay, up to date on a bunch of different areas. But I will say there's definitely no regrets. But I also deal with pharmacy unrelated to cardiology a lot of the time as well. Like even though I do cardiology and ambulatory care, I'm dealing with diabetes, like endocrine related things. And I think that's one of the true benefits of pharmacists is these providers are so heavily specialized in their topics. We have such a broad knowledge base when it comes to these medications. We can really bring so much more to the team because they don't know all the medications. They know they're like select five that they prescribe, right? And do you guys know how medical school works? Do you know how many semesters they actually get of pharmacology?
Like one or something.
Most is one, yeah. So think about that, right? We get 6 years worth, and some of us still don't know it. So we really can help bring that to the team, right? Because these are areas that they don't know. They're learning on the job just as much as we learned it in school. So I think not so much regrets, but I do because I get so much exposure to other areas as well, even though I'm in cardiology. And I think that's how it is with a lot of specialties. You're exposed to just not just your specialty a lot of the times.
Do you feel sometimes it gets too much where you're kind of thinking about pharmacy every day? And if so, like, what do you do to kind of unwind yourself outside of pharmacy?
Oh no, man. I go home and I shut my brain off. I'm not thinking about work at all. I know that's not the case for everyone, but once I'm out of that place, off, not thinking about it. Maybe I'll have a conversation with my wife and be like, this is what happened today. But after that, nothing. There's not a thought in my head. Pharmacy related, at least.
Interesting.
I think for me it depends. I try to do the same. I notice, especially when I come back from vacation, the night before going back to work, I can't sleep because I'm only thinking about it. How much did I miss? How many emails do I have? Um, anyway, that's beside the point. Typically, I think, yeah, we're pretty good at hopefully work-life balance. But to unwind, I feel like working out definitely helps. Running, anything being active, I feel like can distract your mind enough to kind of calm down. Or just general, I like to do yoga, deep breathing, which sounds kind of silly, but anything to kind of draw your mind's focus away from work thoughts, repetitive thoughts, anything like that.
Related to doing athletics, do you because I'm part of the frisbee team here at Rutgers, and so it's like my main concern is that do you ever feel like doing athletics as a pharmacist is kind of a bad idea due to the risk of injury?
My first instinct is no. I mean, I guess I see where you're going with head injury, but like most of our knowledge is in our head. So unless I guess you're having a concussion, if you break your arm, you still have your knowledge. I can't speak to head injuries. I don't know.
We always talk about non-farm treatments, right? Exercise is important. So, especially from cardiology standpoint. So, yes, you should be athletic and exercising. That's very important.
Yeah, okay. I think that's a good place to stop. So yeah, thank you guys. Thank you, Dr. Giaquinto and Dr. Wilczynski, for joining us for this podcast. yeah, I definitely learned a lot this podcast. There's a lot of things I did not know before. And I hope our viewers at home who are listening in also learned a lot. And so, yeah, well, that's it. This episode 7, the first episode of fall of 2024. So, yeah, see you guys
Thank
next
you for
time on the
having us.
Behind.
Yes, thanks for having us.
Thank
Yep.
you.